palpation. Okay, so what do we have in the palpation? First, in this palpation you are going to do a superficial palpation followed by the deep palpation. Okay, first superficial palpation followed by deep palpation. Okay, and whenever you are palpating, note the patient's face for any tenderness. You have to note the patient's face, because the patients make a kind of clenching of eyebrows face whenever there is a tenderness when you are pressing over the abdomen. Then that indicates that you should back off or press little lower. Okay, and if there are, as I told you, different quadrants of the abdomen. If we are going to palpate the liver, okay, this is the abdomen contour, we are going to palpate liver in this direction. How are going to palpate the kidneys? Will go in this direction. Okay, and for kidney you have a bimanual palpation. Okay, this is the liver, spleen and the kidney. Okay, then what else you are going to do? This is about the palpation part of the abdominal examination. Okay, in the superficial palpation you are going to look for any tenderness, if there are any mass, and if the patient is suffering from ascites. In the deep palpation, again you are going to look for tenderness, mass, any organomegaly or any ascites. Okay, superficial palpation. In the superficial palpation, what you are going to look for? Any tenderness, any mass, or if the patient is suffering from ascites. In the deep palpation, you are going to look for again tenderness, if there is any mass, organomegaly, that is hepatomegaly or splenomegaly. Also look for ascites. Okay, this is about the superficial and deep palpation. What if there is a generalized tenderness? What if there is a generalized tenderness? If the patient has generalized tenderness, then it can be due to a generalized peritonitis, okay, it can also be an acute perforated ulcer, okay, it can also be a perforated diverticulitis, okay, it can be an appendicitis or a pancreatitis as well. Okay, so if the patient has generalized tenderness, it can be a generalized peritonitis, an acute perforated ulcer, it can be a perforated diverticulitis, it can also be an appendicitis or a pancreatitis. So what if there is again we are going to, according to the 9 regions of the abdomen. So if the patient has right upper quadrant tenderness, okay, if the patient has right upper quadrant tenderness, it can be a cholecystitis, okay, it can be an ulcer, it can be a pancreatitis, it can also be due to hepatitis. Okay, so what if there is a right lower quadrant tenderness? Okay, what if there's the right lower quadrant tenderness? It can be a appendicitis, correct. It can be a cecal diverticulitis. Okay, what if there is an left quadrant tenderness? If there's a left quadrant tenderness, then the patient might be suffering from sigmoid diverticulitis. What if the patient has flank tenderness? If the patient is suffering from flank tenderness, then it is majorly a renal pathology. It indicates that the flank tenderness is majorly due to a renal pathology. So this is about the palpation part of the abdominal examination. So moving on to the percussion.